Thank you very much for inviting me. So, meniscal preservation has become the rule of the game as far as meniscal tears are concerned, and uh, an attempt is always being made to preserve the meniscus as far as possible. And if I consider our own practice 5 years back, there were 80% cases of partial meniscectomy and just 20% of repair. And today the situation has come to a stage where we are uh, trying to repair each and every meniscus, and there are very little percentage of patients who have to undergo partial meniscectomy. So I'll just a small case, I'll make a presentation of a very complex type of meniscal tear, which a few years back we would not have hesitated in doing a uh, partial meniscectomy, but this case, which we handled about 6 months back, we, we repaired it and with good results. So this was a 28-year-old male who sustained his twisting injury to the right knee while playing football 10 years back. And he presented to us about 6 months back with complaints of pain, instability, and locking. The clinical presentation, the Latchman test was positive, the anterior drawer was positive, there was medial joint line tenderness, the tests for PCLs and collaterals were negative, and X-rays were unremarkable. The MRI clearly showed a bucket handle tear on the sag as well as the coronal views, and this is what we saw when we underwent arthroscopy. There was a very unstable type of bucket handle fragment, which were finding it very difficult to stay reduced. It would reduce, but it was quite unstable. So we attempted to repair this. So in the first go, we uh, utilized a stabilizing stitch in the center, and this is with the air, striker's air, which we have found to be quite user friendly. And this is the first stitch which we made in the center of the meniscus. And with this, the things became a bit easy. So we could divide our meniscus into posterior to this and anterior to this. On the posteriorly, we use this jacket type of fixation above and below. As you can see, it was all the posterior side, we use the all inside devices, and it was quite a bad tear with a double bucket handle and more complex component within. And this is use of a probe to guide the anchor placement. So as you see, we are gradually getting a quite a robust type of fixation. We were doubtful whether this would ultimately heal or not. We did whatever possible from a biological point of view in shaving it, in rasping, using needle to create microvascular in channels. So as you can see, we used a number of anchors at a very close distance of 3 to 4 millimeters. And it is only in the most anterior part we use the outside in technique, both in a mattress fashion. The first was a mattress fashion outside in technique, and the other was a vertical above and below the meniscus. So we could close this gap. Some of the loose portions which were remaining, they were shaved off. And we tried to preserve as much meniscus as possible, just in the hope that it would heal. We had explained the prognosis that the tissue quality was bad. It was a 10-year-old injury. We didn't know at what point of time he had this bucket handle. And wherever possible, we again reinforced our repair with further anchors. So in the end, you can see that it's quite a robust type of repair. We use this needling quite often from the meniscus to the inside, and we can see blood vessels coming, the blood coming through. So we try to improve the biology as far as possible, and at the end, you can see a very stable type of fixation with flexion, extension. There was completely stability, and this patient we have been following since then, and now he's completely pain-free, and he has even resumed his basic activities like running, which he used to do. We have still told him not to do pivoting activities since his muscle strength has not yet returned to what it should be. So this was just to give you an example that how with the current techniques available with very complex tears, uh, they can all be repaired, and in this particular case, we could achieve healing also, because we do not rely much on MRIs because they give positive signals right till even 2 years, but patient being asymptomatic was the biggest relief for us. Thank you very much for your kind attention.